Hi, I'm Dr. Sneha Mantri, Chief Medical Officer of the Parkinson's Foundation. Finding out you have Parkinson's can take time, and the path to a diagnosis is not always straightforward. Today, I will discuss how a Parkinson's diagnosis is made and the types of diagnostic tools to support an accurate diagnosis. How is Parkinson's disease diagnosed? Parkinson's disease, or PD, is a clinical diagnosis. This means that a person's history, symptoms, and physical exam are used to make the diagnosis. There is not a single lab or imaging test that can diagnose PD. However, certain tests can be used to support the diagnosis of PD or to rule out other medical conditions that can mimic PD. Making an accurate diagnosis of Parkinson's, particularly in its early stages, can be difficult. Often, an internist or family physician is the first to make a diagnosis. Many people may seek an additional opinion from a neurologist or a movement disorder specialist. A movement disorder specialist is a neurologist with experience and specific training in the assessment of PD and related disorders. To consider a diagnosis of Parkinson's disease, a person must have bradykinesia, or slowness of movement. In addition to bradykinesia, a person must also experience either shaking or tremor in a limb that occurs at rest, or stiffness or rigidity in the arms, legs, or trunk. Some people may have both a tremor and rigidity at the time of diagnosis. It's important to remember that tremor alone does not make the diagnosis of Parkinson's disease. We look at the full constellation of symptoms, including non-movement symptoms, to determine the likelihood of PD or other related disorders. What to expect at a neurology appointment. The first and most important diagnostic tool for Parkinson's is a medical history and a Parkinson's-specific physical exam. A clinician will make a diagnosis based on a detailed history of symptoms, existing medical conditions, current and past medications, family history, and lifestyle factors. There are several non-movement symptoms, like mood changes or sleep changes, that can even predate the development of any physical symptoms. So a clinician will likely ask about a wide range of topics. Certain medical conditions, as well as some medications, can cause Parkinson's-like symptoms. When I suspect Parkinson's in a patient, I ask them to do several tasks in the office to assess agility, muscle tone, gait, and balance. This includes asking them to walk down the hallway when I can assess their fluidity of movement, the way they swing their arms as they walk, and the way that their feet strike the floor. I also ask patients to do fine motor tasks like tapping their fingers or rotating their arms quickly, again, looking for fluidity of movement. I may also move their arms and legs passively as I check for signs of increased or decreased tone. I will also check reflexes with a reflex hammer and eye movements with a pen light, or ask someone to follow a moving object across their field of vision. Each of these in-office tests gives me information about how the nervous system is functioning and communicating internally. Neurologists and movement disorder specialists use a universal scale to assess and document the exam of people with PD. This scale can be used as a baseline to judge the effect of medications and to track the progression of the disease in future visits. If a doctor feels confident with the symptoms they observe during the in-office exam, they may make the diagnosis on the spot. Tests that can confirm a Parkinson's diagnosis. Many of the symptoms of Parkinson's disease are caused by loss of dopamine, a brain chemical that helps with movement and non-movement tasks. After making a diagnosis, your doctor may prescribe a medication to replace dopamine or to boost its effect in the brain. These are called dopaminergic medications. When people with PD see the improvement in their speed of movement, their stiffness, or their tremor after starting these medications, it can confirm a Parkinson's diagnosis. Lack of response to medications may prompt the doctor to seek an alternative diagnosis and order further testing, such as an MRI of the brain or lab work, When unsure of a PD diagnosis, a dopamine transporter scan, also known as a DAT scan, can also be considered, but it's not needed in all cases. A DAT scan is an imaging technology that allows visualization of the dopamine system in the brain. It's similar to an MRI, but instead of looking at the structure of the brain, it looks at the function. A positive scan can help confirm that there is a problem with dopamine transmission. In many cases, a DAT scan is not necessary to diagnose Parkinson's disease, but your doctor may order a DAT scan if your symptoms are mild or you don't otherwise meet diagnostic criteria. Another way to confirm a suspected Parkinson's diagnosis is through a skin biopsy test called the SYN-One test. This test uses a skin sample from the back, thigh, and leg to confirm the presence of a protein that is linked to Parkinson's. However, not everyone with Parkinson's disease has this abnormal protein, and there are several other conditions that can cause a false positive skin biopsy test. It's important to interpret any of these tests in the context of your overall history and physical exam. These approaches can help confirm a Parkinson's diagnosis, allowing your care team to make a more accurate assessment and develop a treatment plan. 4 things a movement disorder specialist wants people to know about a PD diagnosis. Number 1, tremor is only one sign of Parkinson's, and not everyone has a tremor at all. Non-movement signs, such as sleep issues, loss of smell, and vertigo can also be early signs of Parkinson's disease. Number 2, PD medications can help with specific symptoms, but they do not slow down or stop the disease itself in the brain. Instead, vigorous exercise, at least 150 minutes a week, or about 20 to 30 minutes a day, and a healthy diet full of fruits, vegetables, and legumes has been shown to slow down the progression of PD. Number 3, a comprehensive care team, including regular visits with physical therapy, occupational therapy, and speech and swallow therapy, can help lessen the complications of Parkinson's disease, like falls or swallowing issues. Number 4, PD can affect anyone, regardless of age, background, or family history. Although the average age of diagnosis is 60, it's important to know that 1 in 20 people are diagnosed before the age of 50, which is typically referred to as early onset Parkinson's disease. Early stage Parkinson's is an optimal time to participate in PD research. A Parkinson's diagnosis can feel overwhelming, but you don't have to navigate it alone. Understanding how the diagnostic process works and knowing what opportunities exist early in your journey can empower you to take an active role in your care. Talk with your neurologist, ask questions, and explore the resources available to you. And remember, the Parkinson's Foundation is here to support you every step of the way. To learn more about receiving a Parkinson's diagnosis, visit parkinson.org/gettingdiagnosed.